Hi, we're exercise science students here at YSU, and we're going to be analyzing the heart's functionality and rhythm through EKG analysis.
Some points of interest in this presentation are we're going to be looking over the normal function, first degree atrioventricular block, left and right bundle branch blocks, injury and ischemia, myocardial infarction, and sinus tachycardia. With normal rhythm, we're going to be going through the pathway, and the pathway of the electrical system through the heart goes from the sinoatrial node, which acts as the pacemaker. Action potentials are fired from the specialized cells in this area. This is influenced by the autonomic nervous system, aka like the vagus nerve parasympathetically, and catecholamines sympathetically. The atrioventricular node, or AV node, acts with a slight delay to allow the ventricles to fill. Next, the signal goes through the bundle of His. This is the pathway in the walls of the heart of the ventricles, and from there it goes to the Purkinje fibers, which the nerve impulse divides into left and right branches and causes ventricular contraction. This is a picture of the normal rhythm. As you can see, the first thing on the normal rhythm is the P wave, which is in green. And then there is the PR segment, and from the PR segment this goes into the QRS complex, the ST segment, and the T wave. And from the QRS complex to the end of the T wave is called the QT interval. So what does all this stuff mean? The P wave means this is when the atrium of the heart are depolarized. This is also the depolarization of the SA node. The QRS complex means that this stage is when there is depolarization of the ventricles. The T wave is repolarization of the ventricles. The segments are separated into the PR segment and the ST segment. The PR segment is the time it takes for an impulse to travel from the SA node to the AV node. The ST segment is a period when the ventricles are depolarized. And then there's intervals as well. There's the PR interval and the QT interval. The PR interval is the time the electrical impulse takes to travel from the sinus node through the AV node and entering the ventricles. The QT interval is time for both ventricular depolarization and repolarization to occur. And these are what you're going to be able to tell if there's some sort of block or any type of physiological problem with the heart if any of these are abnormal. So with the normal rhythm, here you can see the nice P wave, the PR segment, the QRS complex, the T wave, and the ST segment, which is from the last of the QRS complex to the end of the T wave. The PR interval is from the P wave, from the end of the P wave to the beginning of the QRS complex, and the QT interval is from the end of the QRS complex to the end of the T wave. The first physiological problem we're going to be talking about is the first degree AV block. This is when there's a problem with the electrical system of the heart, which is there's an overly active vagus nerve. The vagus nerve acts to slow the heart. There is also a delay between the contraction of the atrium and ventricles. And when this happens, this means that there's a delay between the atrial depolarization and the ventricular depolarization. This occurs at the AV node. The first degree AV block risk factors include, there are two types actually. There's congenital and acquired. Congenital is when you're born with it, and acquired is when it develops sometime during your lifetime. Acquired is actually more common. Risk factors are if you're a pregnant woman with an autoimmune disease, this is what causes the congenital type. If you have had a heart attack, or also called a myocardial infarction, and also if there's a diagnosis of the following diseases: coronary artery disease, rheumatic fever, myocarditis, heart failure, cardiomyopathy. Some other risk factors also include surgery, medications, exposure to toxic substances. First-degree AV block does not usually show severe symptoms, but second and third-degree AV block does. Some of these symptoms actually include fainting, dizziness, fatigue, shortness of breath, and chest pain. When we look at the EKG, like I said before, there's a problem with the electrical system of the heart. When we look at the EKG, what we look for is a prolonged PR interval of longer than 200 milliseconds. This is measured from the P wave, which is the atrial depolarization, to the beginning of the QRS complex, which is the ventricular depolarization. A normal interval is between 120 and 200 milliseconds. The problem is determined to be marked when the interval exceeds 300 milliseconds. On this picture, we are able to see what a normal EKG rhythm looks like and what a first degree and second and third degree AV block look like. When we take a look at the first degree AV block EKG, as you can see with a normal rhythm, there's hardly any space between the P wave and the QRS complex. But with the first degree AV block, you can see there is an extended line, which is the PR interval, and this indicates that there is a problem with a delay in the signal of the heart. With second degree AV block, now this is obviously more severe, you can see there's a long time before the first P wave and the QRS complex. And then the third degree, the problem is much worse. You can actually see multiple P waves in there. That's just because the signal is traveling and the heart wants to beat but can't because there's a delay in the signal. Now we're looking at the first degree AV block. On here, the first degree AV block is signified by the extended PR interval, which is there's a long gap between the P wave and the QRS complex. This represents the there's a delay between the atrial depolarization and ventricular depolarization. As we stated before, this can be an AV block is classified when this interval is longer than 200 milliseconds. The next thing we're going to talk about are the left and right bundle branch blocks. The left and right ventricles have to contract at the same time in a normal heart. Nerve impulses travel from the AV node to the bundle of His and to either side of the heart to the Purkinje fibers. A block forces the impulse to go a different route. The block forces a slower contraction of one ventricle compared to another, and it is difficult for the heart to pump efficiently through the circulatory system. Because if you think about it, if the timing is off, filling time may be compromised in both the atrium and ventricles, throwing off stroke volume and consequently cardiac output. Some symptoms of the left and right bundle branch blocks are presyncope, or a feeling of being faint, syncope, fainting. Bradycardia may also be a factor, but you may feel like you are going to faint because there is not enough oxygen-rich blood being delivered to small parts of the heart. Some risk factors of left and right bundle branch blocks include a diagnosed coronary artery disease, cardiomyopathy, and valve disease. If you have also had a heart attack or electrolyte imbalance, this can also lead to some sort of bundle branch block. With electrolyte imbalances, Na+ is actually an electrolyte that the body needs. It plays a key role in conducting signals by causing the impulse to reach threshold so the nerve can fire a signal. Some prevention of the left and right bundle branch blocks include if there's another diagnosed problem with the heart, then it definitely needs treatment. Those with diagnosed cardiomyopathy may need cardiac resynchronization therapy if they have the bundle branch block and the cardiomyopathy. But the bundle branch block alone usually does not need treatment. If it's bad enough, then the patient will be treated with a pacemaker to keep the rhythm of the heart. When we look at the EKG of the left and right bundle branch block, we look for a wider QRS complex, and this signals ventricular depolarization, and this means that the ventricles are taking longer to fire the impulse and to contract. So on the left-hand side, we can see a normal QRS complex, but on the right, we can see a wider QRS complex. So now we're talking about left and right bundle branch blocks. And when we look at the EKG, we can see a significantly widened QRS complex. This signifies that when there is a block, there is a delay between the electrical signal and the contraction of the heart, because the signal has to take a different pathway since there is some sort of blockage along the way.